Dr. Mathewson will probably talk more about Dr. Bickford, but he probably is at the center of everything early on. But mostly it was wonderful to see how he harassed his fellow physicians and nurses and the hospital and to say, this is a problem, and no one could ever say no to Arthur. And consequently, we had a lot of people very involved, and they became glad they were involved.
Yes, I was medical director of Cape Cod Hospital back in the 1980s, and Dr. Arthur Bickford, an internist from Dennis, came to me as medical director saying, you know, we've started this little medical clinic, really, dry socks and Band-Aids out of a closet at the Noah shelter, and we've discovered a great need, and we need to expand, and I need to have some more physicians to volunteer. Would you help us recruit physicians from Cape Cod Hospital? And I said, sure, and that's how I kind of started working with Arthur in the closet at the Noah shelter.
So the O'Neill Clinic was attached to the Noah shelter, and it literally was attached. I mean, we used to walk into the Noah shelter sometimes to get a patient, bring them into the clinic. We had at that time respite, and that was part of the shelter that they let us use the beds. We also had in the basement, we had clothing, and a volunteer would keep track of all kinds of clothes that would be dropped off, and it was amazing.
I can see this thread of mission and innovation and teamwork that I think has been the consistent underpinning of the agency since its inception.
This was another thing that I think really built our profile in the community, that we just became known for this organization that was willing to do whatever it takes, and that's really the motto. The motto and the model for healthcare for the homeless is whatever it takes is what we're going to do.
Duffy embraces health equity, which means eliminating barriers to care, reaching people where they're at, going to find them, and delivering evidence-based care to them equitably. And so that's one of the big ways that Duffy makes an impact in this community.
One of the things that has really stayed with me has been the role that I've seen Duffy play through the COVID crisis. You know, when COVID hit, everybody shifted. Everybody turned on a dime. Everybody was meeting needs as best we could. Duffy really took on a leadership role in our community of care providers and exhibited a level of awareness of need, responsiveness to need, and flexibility to make it happen that really, I think, helped to guide so many of the rest of us, extended partnerships to the rest of us to come alongside, and frankly, I found inspired the rest of us too. So will always be so grateful for that role.
We had the concept of wraparound from the beginning, but didn't have all the pieces, but we knew that's what was needed for our population. And with time, that has become a standard of care, and that's what we do here very well now.
Creating that, what we always call the three-legged stool of really having strong holistic services, case management, behavioral health, addiction treatment, and healthcare. There's always a gate to come in. And so people can fail and they're always welcome back. People can be imperfect and they're always welcomed back.
Someday, one day, somebody is going to say, I want to change. And that happens every day here at Duffy. I'm sick of being sick. I don't want to be this way anymore. I want to change.
In 25 years, Duffy may be looking different, but I think that the cornerstone values and mission will still be there. And I think hopefully we're serving more people with more services. But I want to be clear that hopefully we're not seeing more critical mass of addiction and sickness and homelessness. Hopefully we've solved some of those social fundamental issues in society, and Duffy can really explore what would be the most meaningful for patients.
Where I see Duffy going in the future is just being even more accessible to people, bringing down barriers even more, so when they walk in there, they're surrounded by everybody who they possibly need at that moment.
It really is a beautiful thing that everybody comes together at the same table in order to address the needs of our clients. And the other thing that I think is really special is that it really is Cape Codders taking care of other Cape Codders.
When I think of Duffy, I think of an agency that's willing to go above and beyond to help our community.
Duffy is health.
Duffy is there for our most vulnerable residents on Cape Cod, and I think that critical service is something very unique to the work that your team does, and it's of critical value for our community and for organizations like HPC to know that we can reach out at any time to get support from that terrific team at Duffy.
It's impressive how to see how organized and how much care and loving and compassion, everyone shows it.
Duffy Health Center is innovative, always looking for new programs and new ways to do things. I would say that Duffy Health Center staff are highly professional, and I would say that everybody, all of our constituents at Duffy Health Center, board, donors, staff, are passionate about ending homelessness for people who are experiencing homelessness or unstably housed on Cape Cod.